Okay, I think we'll go ahead and get started. Welcome everyone. I'm Rena Large. I'm Program Manager for the Early Childhood Funders Collaborative. We're so pleased to have you join us today for this conversation about children experiencing homelessness. Housing issues and homelessness are things that are coming up in a variety of intersectional conversations for us. But we haven't had the opportunity to take a deeper look at this intersection. So we're really pleased today to have a chance to learn more about the prevalence and impacts of homelessness on young children and recent research supported by the Pritzker Children's Initiative to bridge the gap between early childhood development and housing homeless sectors. Joining us today to share more about this research are Barbara Duffield, Executive Director, and Aaron Patterson, Director of Education Initiatives at Schoolhouse Connection. They will also be joined by Hillary Moglin and Alicia Q from Rally, which is a communications firm partnering with Schoolhouse Connection on a national messaging campaign to build awareness. But before we get started, I would like to introduce Katie Kelly, Director of Communications and Community Initiatives at the JB and MK Pritzker Family Foundation. She's going to get us started with a few words about why they think this work is important to them. Thanks, Katie.
Thank you, Rena. Good afternoon and good morning to those out on the West Coast. I am Katie Kelly, as Rena said, and I'm joined here today by several of my colleagues from the Pritzker Family Foundation, including our new president, Adolfo Hernandez, and the director of the Pritzker Children's Initiative, who most of you know, Jerry Cobb. They don't let me out much, but today they made an exception, so I hope I do them proud. But we come today before you hoping that you'll take a look at the list that Aaron has put up on the screen and really ask the same questions we asked ourselves. Given the fact that all this is happening, why aren't we hearing more about this in the public narrative? Why aren't we talking more about it? And why aren't we, particularly those of us here today in the early childhood sector, screaming this from the mountaintops and demanding action? I know we have a lot these days to scream about for the mountaintops. So I know that there are issues competing for our time and attention, but the amount of trauma that is caused by being housing insecure or homeless, beginning prenatally, is unparalleled. It is making it not just a social determinant of health, but the social determinant of health. The impact of this trauma on lifelong learning and well-being is undisputed. But the attention to and the design of interventions to prevent and address homelessness is focused understandably on the largest and most visible segments of that population that are unhoused. And while we know that those that are pregnant and parenting very young children is only a small part of the overall US homeless population, it is in fact significant. We at the foundation have turned our attention to this in part because while this population is significant, it might also be small enough for us to have the ability to address their needs. We're making these initial investments in narrative change and in raising the visibility of this topic in both the housing and the early childhood sectors because we believe that we need to expand the universe of those that are discussing this issue and prioritizing this issue in their work. Frankly, expanding the universe of those that are outraged by those facts that you see there on your screen. We know that many of you here are already working in housing and on issues of homelessness, but we thank you, but we need to do more. And we need to not just preach to the choir, but bring new folks to the choir as well. So given your commitment to young children and their families, I'm sure you're equally outraged that our nation still allows this to happen to those that are pregnant and parenting young children. I'm glad that you are also outraged because your involvement is necessary to the success of efforts to change both the narrative as well as change the reality for tens of thousands of families. So that's why we're involved, and I'd like to turn it over to the teams at Schoolhouse Connections, our partners at Schoolhouse Connection and Rally, to talk more about their work and their plans. So I'll turn it over to you, Barbara.
Thank you very much, Katie. It's nice to be here with everybody. For those of whom we are new, we are a national advocacy organization working at the intersection of early development, education, and homelessness. We engage in policy advocacy at the federal and the state level. We provide a tremendous amount of practical assistance, and we have a youth leadership and scholarship program where we are directly supporting young people to and through higher education. Specifically looking at our time with you today, just a little bit of a roadmap, of a little bit of an issue overview. Erin will share some of the current data on homelessness, prevalence, and access to early learning. And then we'll really look at our communications work, the learnings to date, and give a preview of what's to come in terms of a communications and messaging campaign, and really want to have quality time for a discussion with you. So we'll keep our presentation succinct. But to get started, just to sort of level set, when we say homelessness or we talk about infant and toddler homelessness or homelessness, we are using the definition that comes from the early care and education subtitles in federal legislation. So it's a broader definition. It includes, of course, people who are unsheltered as well as those in shelters, but it also includes families who are staying with other people temporarily because they have nowhere else to go. And it also includes those who are staying in motels, regardless of how that motel is paid for. So it's a broader definition. I took a screenshot yesterday. The New York Times opinion section did a very in-depth look at homelessness broadly, all populations, all living situations in a first-person narrative. So we were pleased to see that there was one entire section just on families who are staying with others because a couch is not a home. So there's a link to that, a very powerful series for you to look at later. It was specifically when we're thinking about families with young children, expectant parents, and families with young kids, just a little bit of context about that invisible category of staying with other people. It may seem like it's a safe place to be, or there's a roof over their head. But what we know for what parents tell us is that they're often staying with other people temporarily because there are no shelters. Shelters are full. Shelters are turning people away. They're afraid of shelters. They're afraid of child welfare. And so they're staying in temporary situations where they're very hidden, very hard to identify. And also there are some significant dangers there. If you think about safe sleep, for example, and you have a mom with a baby on a couch, there are safety issues as well. So we really like to focus, and we talk about the hidden homelessness and the invisibility, to talk about the reality of how many families across the country do experience homelessness. And that'll play into our definitions too. Super quickly, just two quotes. This is a quote from a young mother in a Chicago shelter, which speaks to the fact that pregnancy is a risk factor for experiencing homelessness. And that is how she became homeless, was because she was pregnant and kicked out. And the next quote, the next slide, from one of our partners in Early Start in Chicago, not knowing that the mom didn't know she met the definition of homelessness. And it was actually the Head Start program who let her know that she was meeting the definition of homelessness and was able to help her access other resources. So that important connector role of early childhood programs. And with that, I'll turn it over to Erin to share more about what we've learned.
Great. Thank you so much. And thank you again to those of you for joining this conversation today. Understanding that foundational definition of homelessness and the impacts that Katie shared, particularly on her opening slide. A next question might be, so then how prevalent is this? And I want to share first what we know from external research and data about the prevalence of homelessness among families with children. And the takeaway here is that it is on the rise. You can see here that HUD, the Department of Housing and Urban Development, has reported a 16% increase among families staying in homeless shelters or who are visibly unsheltered. That's a 16% increase. And it's important to note that it's just among those who are visibly homeless. So as Barbara explained, our definition also includes those who are doubled up, those who are staying in motels, might be sleeping in a car. There's a 16% increase in those we can see. And the other takeaway here is that babies are actually the age group who is at greatest risk of eviction. And this research comes from Eviction Lab. And you can see there that about a quarter of Black babies and toddlers in rental households face the threat of eviction in a typical year. And so that is shocking I hope it is shocking. And we also know that a little over 15% of infants and toddlers live in crowded housing, which, as we know, can jeopardize development, healthy development, and set the foundation for lifelong skills. And as Barbara mentioned, pregnancy and parenthood may actually increase the risk of youth homelessness in particular. And in fact, it's the second highest risk factor for young adult homelessness, second only, you see there, to lacking a high school diploma or GED. And so these are sort of our broad understandings and statistics about homelessness among expectant families, infants and toddlers, and young children. With support from Pritzker, Schoolhouse Connection has been able to drill down even further and more specifically into defining the breadth of this problem. And we issued an inaugural infant toddler data report about a year ago, examining 20 states. This year, we've been able to expand to include data from all 50 states. And what we found is that around 600,000 children under the age of 6 experience homelessness, nearly 400,000 of whom are infants and toddlers, just to give you a sense of the breadth of the issue. Less than 12% of infants and toddlers experiencing homelessness are currently connected to an early childhood development program, which is critical, as we've established, for healthy development and for mitigating the impacts of homelessness. And so what I hope you'll take away is that almost 90% of infants and toddlers experiencing homelessness are not identified, not connected to, not enrolled in an early childhood program, which can not only help the child, but help the whole family as well and connect them to other services, including housing. To give you just a more specific sense really quickly here of the programs that we examined, you can see the enrollment numbers in Head Start and Early Head Start. Local education agencies actually do and are responsible for identifying and serving children experiencing homelessness who are not yet school age. And so you can see here the importance of those early childhood K-12 connections. And then we also examined a limited amount of home visiting data. We have access to Healthy Families America and Parents as Teachers, recognizing there are about 16 more models out there who we hope are identifying and serving families experiencing homelessness. But this gives you a sense of the low rates of connectivity of families and young children experiencing homelessness to the very programs that can help them. So then this brings us to our challenges. Lack of awareness is the fundamental challenge, and Katie set it up beautifully. We know that infants, toddlers, and expectant parents who are homeless need both quality early childhood development and access to safe, stable, affordable housing. But what we have witnessed is that their needs are not prioritized by either sector. And so then the fundamental question before us is, how might we raise awareness and build understanding of homelessness among both the homelessness and the early childhood development sectors? And our goal is so that each prioritizes infants, toddlers, and expectant parents experiencing homelessness and can ultimately ensure that children and families thrive. We have set out to answer these questions through a discovery phase. This is our process and our timeline that you can see here. And in just a minute, I'm going to turn it over to our colleagues at Rally to dig in a little bit deeper into the next phase of this work, the execution phase. But you can see here, we have gone through a discovery phase. We have developed a strategic framework, worked through some positioning and messaging. And we'd love to share with you what we've learned so far to get at that fundamental question. First is that babies, infants, toddlers, and families are largely invisible in conversations about homelessness, and that's a problem that we are hoping to address. We also found through media research that discussions involving children are actually related to housing rather than homelessness. And it's a slightly different slices of the problem with different approaches and solutions. And so that's important to acknowledge. We also noted that a lot of our national early childhood partners in particular usually use proxies like economic stability, which doesn't get specifically at the root causes of homelessness, and it doesn't get at homelessness as a root cause of some of the other systemic challenges that we observe. We also learned through parent focus groups. Parents in particular themselves said they are frustrated with the resilience narrative. And this was a real learning moment for us. We like to talk about children as being resilient, but parents experiencing homelessness shared with us that they often find that that's used as an excuse for tolerating what the child is going through when they are experiencing homelessness. And they are a little tired of that. And then also this perhaps shouldn't be surprising or won't be surprising, but parents experiencing homelessness when making decisions about connecting with early childhood programs, they typically trust parents with lived experience the most and much more than others, particularly those who are working in the system. We also know that addressing homelessness upstream as it relates to children will have impacts downstream when we talk about adult homelessness. And then lastly, the message needs more champions. Just as Katie started with and noted, we have to have more people shouting this from the rooftops. So what's next? I'm going to turn it over to our colleagues at Rally to walk us through a communications messaging campaign.
Thank you, Erin. My name is Hillary Moglen. It's nice to be with you all. I work at Rally, as mentioned. And we're going to jump in a little bit to give you a sense of the work we're looking to do next, the work we'll be doing next around our communications plan. So going to the next slide here, Erin walked through the process that we've gone to together, including an articulation of the challenge, which I think is on the next slide, which is how we are thinking about, and we think about this from a communications context, but how we are thinking about this problem that, that she had already articulated. So I can already go to the next slide. So what we do in our process, and sorry for the eye test here, we're happy to share these materials so folks can read it themselves. But essentially what we do is we do, through lots of different analysis of different inputs we've gathered, a sense of kind of where we are from a current state and then where we want to be going in terms of our desired state. This is a strategic framework process we do at Rally with all of our clients in the advocacy space. And while I'm not going to go through each of these in detail, it is worth noting that we have put them in sort of these three large categories. One is around what is the narrative? What is the current state around the narrative? Where is it now? Where do we want it to go? What is the current state around the norm or behavior of those who are working in these different sectors? What is it now and where do we want it to go? And then on a system level, right? We have here a little bit more, we couldn't fit it all in one bullet point on this one. So we had three different parts on this one. But it's important to understand sort of how we're thinking about the challenge we're trying to solve in these three different parts from a narrative perspective, a norm perspective, and a system perspective, and how we then use communications to move us from our current state to our desired state. Going to the next slide. At the end of the day, from a strategic approach, kind of big picture is how do we create, espouse, and socialize a new norm for how and why we address early childhood homelessness. And you'll hear us talk about norm a fair amount here. Norm being the behavior and patterns of particular folks in here in the two different sectors that have been articulated. How do we create a new norm? And then from that norm, how do we then create a narrative, build a narrative that is then more of an external facing piece? So going to the next slide here. These are the three kind of strategic pathways that we're thinking about in our communications work, right? So again, these mirror that current state and desired state slide that I had just passed through. One is building a narrative where the need to address infant and toddler homelessness is a public benefit rather than a public responsibility. So that gives you a sense of how we would think about framing that narrative. Second is inspire and connect a community of partners and leaders to shift norms, right? Going back to the behavior that we want to be seeing in those particular groups of partners and leaders within the two sectors. And then third is fostering supports for an action toward upstream approaches that address infant and toddler homelessness. And that gets more at the sort of some of the policy and structural pieces that we were grappling with in that current state and desired state that I had talked about earlier. Now I'm going to pass it to my colleague Alicia to walk us through this next part.
Thanks, Hillary, and thanks everyone for being here. Really great to speak with you. In thinking about how we structured a communications plan, there are a whole bunch of different ways we could do that. We could have taken each of those pathways that Hillary just walked us through and underlaid tactics below each of them. But as Hillary has mentioned, there's a sequence to the work that we want to do to drive systemic impact. There is this building of a new norm that we then socialize out to change behaviors and the ways that our beliefs and our norms are expressed, and then expand out to a systemic or policy level, at higher level, the last step, if you will. And so the approach we have taken to formatting the plan and to address each of these steps is, you can think of as concentric circles. These are our audiences as well. We're going to start with building a community of advocates. We hope that some of you will join us in this group. The folks who are most proximate to the issue, to start changing beliefs and values in the ways that we address infant and toddler homelessness, so that we can expand out to our communities, to our networks, and then eventually that creates and leads to policy level change. And so on the next slide, you'll see a different graphic that kind of crystallizes this against the audiences and also the phases of work that we're going to be undertaking. In the most immediate term, we want to be reaching early childhood development and housing homelessness providers, funders such as yourselves, and other credible early childhood development and homelessness organizations who, again, are most proximate to this issue. They have a part of the picture, and our hope is that seeing the full picture of infant and toddler homelessness, the ways that these dots need to be created, be connected, the bridges that need to be built, seeing that helps socialize new norms, new beliefs, and expands into more impact so that we can reach federal agencies, other high-profile advocates and spokespeople in the medium term, and expand out to folks working on adjacent issue areas. They may not necessarily be focused on infant and toddler homelessness, but they work with young children or slightly older children. They're doctors, they work in economic security, again, these proximate issues. And as we expand that reach, we can expand and expand in the long term to reach policymakers and parents, to ultimately work to change policy and in the way that parents ask for the support that they need and the way that we are able to respond to that. And so we're thinking about that plan. On the next slide, you'll see a timeline. We have phased it out very neatly in the first 6 months, really focusing on the immediate term audiences, this building of a community of champions, a community of advocates. In the second 6 months of our execution, beginning to expand to medium term audiences. And then as we see it now in month 13 and beyond, being able to move to, again, those longer term audiences. But of course, narrative building, norm change, all of this takes time. So we do want to take a pause at that juncture between month 12 and month 13 to assess where we are, what's still needed with our first two audiences, to make sure that we're doing that well and really solidly before we move on to long term. On the next slide, the way that we are going to approach each of these phases, we have must do, should do, and dream big tactics. Must do tactics are the things that are essential, that we have to do, as the name says, to achieve our goals in each phase of this work. That's creating that community of champions, doing the one-on-one outreach to those audiences, developing the materials, building out a media plan, owned, earned, and paid digital, these spokespeople. There are more, and we're happy to share the full plan with you all, but as was said at the top, we wanted to keep this succinct so we could have a discussion about all of this. The should do tactics, these are the things that make us even better, that increase our reach and engagement for each phase. So story banking, making sure that we have the stories of those who have been helped in the way that we want them to be helped, the exemplars in the field, highlighting those programmatic successes, increasing that visibility through earned and owned, and webinars with partners in the network so that we're all learning from each other. And then the dream big, these are the things that take additional time, investment to be able to execute, but we think have really high impact. So hosting an in-person event with our initial community of champions to be able to envision what this looks like and really set a course to be more strategic and deliberate with paid digital strategy. Creating videos, storytelling is really important. And one really great way to do that is through storytelling. Again, this is not an exhaustive list of the tactics we have proposed and are going to be undertaking for the first 2 phases. And we're happy to send out the full plan. There's relative alignment on the first 2 phases. As I said before, for phase 3, expanding out to those long-term audiences, we do want to take a moment, reflect, and whenever that month 13 or whenever it is, make sure that we're approaching long-term with, eyes wide open, knowing exactly what is needed. That's a very quick overview of the communications that we're going to be undertaking to change norms, build a new narrative. And I think I'll turn it over to Erin. We have some questions for you all.
We do. Thank you so much, Alicia. We do have some prompts that we're curious about, but really want to leave it open for your reflections, reactions, questions, and discussion. So we'll pause and practice our teacher pauses.
I wanted to mention that at the beginning, I said that, as an organization, we had not taken a deeper look at this previously, but we do have several funders in our membership community who either are working on homeless issues or have that background or are, doing something either in their foundation or in their community. And while we are waiting for people to think about these questions, I wanted to see if Karina Moreno from Mimi and Peter Haas Foundation would like to say a few words. You have some background working on chronic homelessness at Tipping Point, but you also are on the board of some local work going on in San Francisco. And just wanted to see if you would like to say a word about what we're hearing. Did anything surprise or resonate with you from what you're seeing in your local community?
Thank you. And yes, definitely. I'm really happy to be here and just want to thank Pritzker and Rally and Schoolhouse and of course ECFC for having this really important conversation. It's interesting. I used to be a housing and homelessness funder. Now I'm an early childhood funder. And, in an ideal world, I'm both always, as we all should be who care about children and families. The very first question, did this resonate? Yes, yes, and yes. For those really quick, the Mimi and Peter Haas Fund, we're based in San Francisco. We've been around for over 30 years and we've always focused on early childhood education. And the truth is, in all the years we've been grant making in this realm, we've always had grantee and grantee partners that serve families experiencing homelessness. This is not necessarily a new issue. However, for my fellow Californians on this call, we know that it is really worsened. And, one of the presenters talked about it's really on the rise. And I can validate that just double clicking here locally. So the Mimi and Peter Haas Fund has our flagship grant making program is what we call the Model Center Initiative, where we fund 10 high quality early care sites across the city who serve low-income children. And I was just looking at the data the other day. Across that portfolio, about 5% of the children this year are experiencing homelessness. But what's interesting is when you dig in more carefully, the range is anywhere from 0 to 18%. So one of our sites has 18% of their children experiencing homelessness that we know of, because I think the point is really well taken that this is really underreported. And that 18% figure, again, I was looking at it last year, that same site was reporting 10%. The year before that, 4%, the year before that, 2%. So you really see this trend line of increasing numbers of children that are either homeless or unstably housed. And then the last thing I'll say is, you know, one of the issues that we're really seeing that is probably not surprising to anyone here is that the lack of housing stability has real implications for early assessment and identification of special needs, as well as behavioral health interventions. So this is something that we see across our grantee portfolio, and really, you know, attending to the needs of those children when they're not stably housed is even more challenging. So the other mantra I throw into the conversation is just not lack of awareness, but lack of coordination across all the different systems that need to serve families effectively. So those are a couple of the thoughts that came to mind.
Thank you. We'll just open up for conversation, questions, comments, things that surprised you or resonated with you. Feel free to type in chat, or you're welcome to come off mute.
Hi, Rena. Thank you for holding this conversation. My name is Michael Durham, he, him pronouns, and I'm the Director of Networks here at Funders Together to End Homelessness. So I wanted to just name my presence here and just really appreciate that there is so much overlap between our conversations and what we're doing at Funders Together. And there are inappropriately siloed buckets of work here that in my work, I facilitate a group that focuses on youth homelessness. And that certainly connotes unaccompanied youth, so young people who are disconnected from their families of origin. But we are also really focused on prevention of homelessness here at Funders Together and within our youth homelessness network. And of course, that necessarily means that we are intervening before people are disconnected from their families, so usually younger in life. So I think that this conversation is critical, and I'm really grateful that there's so much interest in it. And I want to just, promote the work of Funders Together. If you are if you are new to thinking about housing justice, or maybe that's not a phrase you're familiar with, housing justice, I encourage you to get involved with us. And for us, just to give you a preview into our understanding, it's important to name that structural racism is responsible for all of the data that we are so troubled by on the slides that have been shown. And that is because racism is integrated with capitalism and all of the systems that cause so much instability in people's lives and ultimately harm children some of the most. And of course, Black and Indigenous people are at the highest risk for all of the harms and compounding traumas associated with homelessness. So let's not forget that role as well. So thanks so much for holding this conversation.
Thanks, Michael. And we'll include Funders Together information in our follow-up info for attendees and registrants as well.
I have a question, unless there's a funder with a question. So when you're thinking about the communication strategy, what are you asking folks to do, right? Like, so we raise awareness. Is it going to be like really targeted? Like, if you're an early childhood provider, you should be enrolling more people. If you are, a housing policymaker, you should be looking at the policies and see if you could prioritize this population. Like, is it going to be targeted like that toward people actually changing? Because I noticed making policy it seemed like it was going to be really far down the road, and I felt a sense of urgency when I was looking at it.
Yes, absolutely. That is the things that we're asking folks to do, I think, happen on two different timelines. There are the things that happen now. So for early childhood development providers, it is assessing for, and Erin and Barbara can speak to the specificity here, making sure that they're identifying the infants and toddlers who are experiencing homelessness. On the other side, for homelessness providers, how are they addressing the needs uniquely of infants and toddlers and their families? And then on the longer term, this awareness building, this norm change is getting folks to see the need to start changing those systems to work in an unsiloed fashion. I love that, Michael, you used that term. It's one that we've been throwing out around also, but to start connecting those dots to build those bridges. So the things that we're asking for folks to do happen on 2 different timelines.
And I'll just jump into real quickly to say that the policy work, some of the things happen at the same time too. So you have to have a general understanding that these children exist, that they are experiencing homelessness, that the harms are there in order to get to the policy conversation. But for example, the Eviction Crisis Act will be reintroduced in a couple weeks. It disaggregates by age. It didn't have disaggregation for children. There was no coordination language for early childhood or schools. There was early childhood development programs weren't considered grantees. So we continue to work on the policy work at the same time as we have to have a larger conversation, because the staffers who are working on that, they're not even talking about infants and toddlers or young children experiencing homelessness. So it's sequential, but at the same time, the urgency of the policy work is happening now too, and we recognize that. Sorry, Hillary, I didn't mean to interrupt you.
You said exactly what I was going to say, and I would add one piece to, which is to say, we need to get folks appreciating the challenge, that awareness piece before we can make the asks in a lot of ways, right? Just that's sort of human nature. And so, yes, the triangle visual that we presented in the deck is imperfect in that it's not so linear and so sequential, but it is important to understand the phasing of the work, because we do need to build a community of folks and spokespeople and folks who can help spread that word within networks, within conversations, within conferences, things of that nature. So some of the communications is more in a traditional way, earned media or owned channels, as we described it, but a lot of it is peer-to-peer communication and learning and teaching. And we need to be assembling, galvanizing, mobilizing those folks initially to then be reaching these other folks over time. So important to note, yes, these things are not so linear that there won't be multiple conversations and the policy work is ongoing, but there is a phasing and a cadence that we see in our advocacy campaigns, in our narrative building efforts, where that is sort of how that ends up being sticky and also scalable.
I have a question. Hi, everybody. My name is Julie Kokolgami. I'm from the American Family Institute. Can you tell me what success have you had de-aggregating this from general housing issues, right? So, within the early childhood space, there are many issues, that come to mind as we work towards equity. I just want to understand what the de-aggregation from the general housing fight looks like, and why, and have you seen more success?
Barbara, I don't know if you want to start. So thank you so much for that question. In terms of, and we did acknowledge on the slide, this often gets coupled into a housing problem, but those are 2 distinct issues, housing and homelessness. And the first thing to say is, as we've acknowledged, the definitions are different. And so because the early childhood development sector broadly uses the McKinney-Vento definition of homelessness, it's important first for early childhood providers to understand that definition, to understand the signs to look out for, and to understand best practices for reaching families who are experiencing homelessness, including those in doubled up motels, living in cars, in addition to shelters and unsheltered. In turn, there is also, though, simultaneously an access to housing piece of this, that if babies are at the greatest risk for eviction, we need them also to have access to housing with their families. And part of that goes back to the structural difference in definitions. Many of our families experiencing homelessness will not be eligible for HUD housing assistance because they do not meet that HUD strict definition. And so that still leaves us with over 500,000 young children who are in need of both housing and consistent access to high quality early childhood development. And so we see these as 2 simultaneous yet distinct issues. And I know it's played out, but the phrase goes, we can walk and chew gum at the same time. And in fact, I think we have to. And Barbara probably has some additional thoughts to add here.
No, just to say that we do have the exemplars, the providers who are doing both, but whether it's a provider who is both an early Head Start grantee and they are also offering transitional housing. So there are definitely people out there who are able to talk both languages and cross that. But if homelessness is understood to be solely a housing issue, you're cutting out entire sectors that can be helpful. If, on the other hand, you're not talking about housing, you're just talking about sort of at-risk children generally, then you're missing one critical piece. So we have to make sure that we're addressing this holistically, and that's why we need to bring the sectors together. Because again, overly simplistic the crafting of problems leads to overly simplistic solutions, and that they're not cutting it right now. Michael, go ahead.
Yeah, I'm really interested in the nuance that Erin and Barbara just pointed to, which is to say that housing is homelessness is a housing problem, and also it's not that simple, is what I think I heard you say. And I think that's true, but I want to just point out that in case there are folks in this conversation who are new to thinking about homelessness, that differentiation between housing and homelessness can be dangerous for especially like right-wing audiences. Shannon, you're shaking your head as if you can't hear me, or
No, I'm really confused, honestly. So
Oh, okay.
actually let's dive in a little more. I don't understand why it's different.
Wonderful. So there are certain outlets, and this was in the news, not that I read Fox News, but this was forwarded to me as recently as last week, where homelessness is characterized as like a substance abuse problem or a mental health problem, when in fact, most people who have mental illnesses are stably housed. Most people who have addiction, like I do, are stably housed. And when people have stable housing, they're no longer homeless. So there's like and we've got narrative experts on the call here. So there's a narrative component to this that is really important that we're clear that when people are stably housed, they're no longer homeless. And the nuance is, yes, there are so many factors that make housing so unstable for so many people. That can include addiction, that can include lack of access to education, that can include a lack of access to healthcare. So it is complex, but we have to be careful about the potential for that language to be weaponized by those who want to criminalize homelessness. Does that make it any clearer at all?
I would love to add a yes, and if I could. Yes, Michael is absolutely right. Once a person is housed, they are no longer homeless. However, the impacts of their homelessness experience remain. And we do have research among young children in particular showing that even once their families are stably housed, the negative impacts of homelessness remain 6 months to years later. And so that's why we talk about, as Barbara mentioned, this is a holistic approach. It's not just let's give everyone a house and then we can forget that they've had a problem because it's solved. It's that we have to take a holistic approach to addressing the long-term impacts of their homelessness experience, particularly among young children, particularly among expectant families, for whom the foundation of a child's life is homelessness. And among that prenatal to 3 age population in particular, we do have a responsibility because they cannot verbally speak. They can't say how the trauma is impacting them, but it shows up in behavior. It shows up in their routine or lack thereof. And so looking for those signs and impacts is critically important, even after families receive housing.
And I guess
Yeah,
I'll
and I
do
totally
another
agree.
yes, and sorry, Michael, go ahead.
No, I've already spoken. Go ahead, Katie.
Just, there's part of this where we are kind of, battling the currents that are running against us. We're all familiar in all of our work with the populations whom we serve, that there's the deservedness narrative. Well, if they only hadn't had that other child, or if they only hadn't gotten addicted, or if they only hadn't made that poor choice or quit their job, that somehow people put themselves in this box. And so, that narrative is very much out there that we have to work against. And then the other thing that we have to work against, and it's been mentioned a few times about getting rid of the silos between these sectors. We have to get rid of the competition between those that are working on youth homelessness or those that are working on veteran homelessness, that we're all trying to go after scarce resources. We know that only 1/4 of the people that need rental assistance receive it in this country. So there is that scarcity. But instead of looking at it as competition over scarce resources, what we hope to do is say, hey, we can bring a bunch of other people to this party, to this fight, for more housing, for more assistance, for these families. So, you know, there are a few things that are working against us, but I think they're just, like in everything, there's power in numbers. So that was my last yes and. Michael, I'm sorry, go ahead.
I'm not trying to dominate the conversation. I was just going to agree with what Erin clarified there, that I think one of the failures of the so-called movement to end homelessness is that we stop paying attention to folks after they've moved on indoors. And of course, there is so much that folks need, that services should always be offered on a voluntary basis, but folks need support in order to stay stably housed. And again, like, to me, ending homelessness is the baseline. Like, housing is a human right, and therefore we should all just have access to it. But that's not the end of the story. That is the foundation of a life where we're thriving, by no means like the ceiling.
Thank you, everyone.
This is Karina again. I just wanted, since we're talking a lot about communication and messaging and narrative change, I think the other thing to pay a lot of attention to and be mindful of is not pitting the issue of homelessness that families and children are experiencing against single adults, or quote unquote the chronic population. Because I think that there is a caution about getting into kind of deserving and undeserving. And, in this country, I think that the children's message is a little bit more accessible to more people. So that's just the other thing to, I don't think I saw anything that made me concerned in the data, but I think that's just always something to be aware of. Certainly when I worked in chronic homelessness, we got this a lot. That's a population I don't really care about. It's the children I most care about. So just wanted to mention that.
I don't know if this came through in the rally presentation, but I'll just to emphasize, in many sectors, there are conversations about narrative change. There is no narrative here. No one is talking about infants and toddlers and expectant parents who are experiencing homelessness. It's narrative creation. And I think that's a really important point to emphasize too. Even with the recent HUD report about increasing homelessness that was cited here, families, even though they had the largest percentage increase, it wasn't a point, it wasn't a conversation. So part of what we need to do is just bring this issue to light, and then have the narrative creation that isn't pitting people against each other or silos against each other, but is having a frank conversation about who is experiencing homelessness, why, and what they need to never experience homelessness again.
Can I ask, when we were working on this a long time ago, back when I was in the government, we worked on it a fair amount, and Marcia Baslow, who was our leader, is on here. So hi, Marcia. One of the things that I found hardest to grapple with, because of how siloed the government was, and warning to Todd, I'm about to call you in, is the whole issue around identifying, because of the very real, not imagined concern that if you tell somebody what's going on, they're going to call CPS, and then you're going to be separated from your children, right? And so I'm wondering if you guys, I don't know if Todd, you have any thoughts on that, if that's something you're working on, but I also think, and Karina, maybe you have real life experience with that, but it really complicated some things we were trying to do in the early childhood space in childcare, about making people eligible. It just it made it hard, right? Because it was like, well, you could ask them like this, and if you ask them this question and they say it this way, you can make them eligible and you could get a subsidy. And the children's advocates within the homeless community very appropriately shut me down immediately and said, there is no way that you should have people asking that question like that, because you are opening people up to investigation and having their kids removed. So I'm just wondering if that's coming up, and should people be aware of it, and what should we be thinking about?
I'm happy to jump in with initial thoughts. I do see Teresa has a hand raised, and I don't know if it's to this question or if you had another comment, and so I don't want to overstep.
No, thank you for checking. I have another comment, so please go ahead. Happy to.
Okay. Yes, Shannon, thank you so much for bringing that up. A couple things on that. One thing the Schoolhouse does a number of practical assistance trainings and technical assistance presentations. We've worked with Head Start regional trainers, childcare providers, statewide networks, et cetera. And at that provider level, that is absolutely the gut reaction, because they are mandated reporters, because they are trying to do the right thing. And so the one thing we communicate first is homelessness does not equal abuse and neglect. The reason we use the language experiencing homelessness is to convey that this is happening to the whole family, to the parent, just as it is the child. The parent is not thrusting this upon the child. So that's number one. We also offer a lot of strategies, practical assistance tools, sample templates, for how to work within your existing enrollment forms and housing questionnaires to ask the questions in a respectful, sensitive, culturally appropriate way. That gets at not just, are you homeless? One of our first recommendations is take the word homeless off of everything. Number one, because it gets people on edge. It makes them think you're going to report me, I'm going to get deported, whatever the situation is. There's so much lack of trust already in the system. Number two, when we think about Doubled Up in particular, families often don't see themselves or understand that they are experiencing a situation that entitles them to additional supports, rights, and protections. We work a lot around cultural implications. We work with some providers or school district liaisons who say, well, I think that's just their culture if they're working with a Hispanic family who might be doubled up. And actually, there's a difference between a choice and having no other alternative, which is what the federal definition says. And so we work a lot with providers to understand those nuances and to have the conversations and introduce the topic in a way that puts families at ease so they know you have something to offer. You're not trying to get anyone in trouble. But I really appreciate that question, because it is, we hear it more and more with the focus. Some states are very trying to build up their family first grants and supports. And one avenue we're trying to pursue data-wise is learning more about how many families with children are initially referred to CPS with the sole reason being housing and homelessness, because that might also give us an avenue into understanding more about where to poke and prod.
Go ahead, Todd.
No, I want to just say that, Barbara and Aaron have so much experience in this area, and I really trust them. And I think to Barbara's earlier point, I think we have to be careful from shying away from this conversation for fear that, I mean, if we don't shine a light on these families and this issue, then we won't be able to talk about, changing mandated reporting laws to make more sense. We won't be raising the issue of, technically, homelessness should never be a reason for bringing someone into the child welfare system. And so the only way we can make sure that doesn't happen is if we keep raising this issue and shed light on, on the kind of supports and network that keeps that from happening. So, I think it's important to not be afraid to, to talk about this in the open light. And I have this is probably separate, but I really appreciate Pritzker funding this, and I appreciate the work by Rally to do this work. I feel tired a little bit about, we've tried so much narrative change work over the years, and I feel like, we every time we make progress, a different narrative pops up or a different barrier pops up. It's really important to keep trying it and to be responsive to kind of the challenges that keep popping up.
Thank you. Teresa, I see your hand is up.
Hi, thank you very much. So I just wanted to raise a thought of mine that's come up as I've been listening here. I come to today's conversation with, I think, a bit different of a vantage point. I am not personally a member of ECFC, but my colleagues and teammates are. So I have colleagues who work in early childhood education, early child care, but my expertise sits in birth justice and working with families in the perinatal period, which often has a lot of obviously has a lot of overlaps to early childhood, specifically the conversation that has revolved around infants, toddlers, and young children today. Certainly those overlaps are there, and there are a lot of places for collaboration. And on my team in particular, we have been working to try and reduce silos between thinking about birth justice work as separate from early childhood education and early child care work. So I just wanted to elevate today in this conversation that I think it has been mentioned, but I think it needs to be I just want to say explicitly that pregnancy and homelessness are, or experiences of homelessness or housing instability are huge issues in the birth justice space that really readily contribute to these issues in the life of young children, but that there are also really big gaps where funding has the opportunity to intervene to support pregnant parents and birthing families before those children are even born into these experiences of homelessness. I know that at the beginning of the slide, or at the beginning of the presentation, there was some information about birth risk factors that are exacerbated when parents experience homelessness, but that there are a lot of opportunities to intervene before children even are born. And so I think that there are a lot of models of thinking about early childcare and this whole family multi-generation point of view with parents, birthing parents first, and a lot of one group that comes to mind are the Healthy Mothers, Healthy Babies coalitions. There are many Healthy Mother, Healthy Babies coalitions across the United States, really across the world, but each of them have different focus areas. But the big driving force there is that healthy mothers, healthy babies, using more gender inclusive terms like healthy birthing families, healthy babies come in that order. So working to address the needs of parents first does produce these outcomes, these better outcomes for children. I also wanted to raise the point that has been elevated in different places, but I think should just be reiterated again about pregnancy and housing instability and the experiences of young people specifically. Almost half of self-identified women who are under the age of 25 experiencing homelessness are either pregnant or parenting. So this is a really salient issue when we talk about autonomy for youth, autonomy for young people, making sure that there are systems in place to support them and those impacts that it has on children and across through the perinatal period, but then into this early childhood period as well.
Thank you. So we are at our scheduled adjourn time, and I want to thank Schoolhouse Connection and Rally and Pritzker for working with us to have this conversation. We really appreciate all of the questions and the comments, and we'll be thinking about what strands we might be able to pull into other programming. In the meantime, I know that there will be some more materials coming out on the communications campaign. There's some reports that are already on Schoolhouse Connection website. There's other reports that are coming out on exemplary work that's going on. So we'll make sure that everyone is looped into all of those things that are coming out. And I'll follow up with Barbara and Erin and Alicia and Hillary to see if there's specific like next steps that people that attended today should be keeping an eye on. Thank you for joining us. This was recorded, so we will share out the recording later, and you can share with colleagues in case there are funder colleagues who missed this conversation. Thank you so much, everyone. We really appreciate you being part of our conversation today.
Thank you. Bye.